Hi everyone. Today we will discuss about hyperthyroidism. Hyperthyroidism. Let's have a view of thyroidism. You can see there is enlargement of thyroid gland in the neck region, which is called hyperthyroidism. Normal function of the thyroid is to produce such hormone which are uh, effective in the normal regulation of body, like growth hormone or T3, T4. This is important in the normal metabolism of the body. So in hyperthyroidism, there is an increased circulatory concentration of the thyroid hormone. If we discuss about the pathophysiology of the, so if there is a benign adenoma or adenomatous hyperplasia or follicular cell adenoma on the thyroid gland, causing increased secretion of the thyroxine T4 and the triiodothyronine T3. these this term is known as hyperthyroidism whenever there is an increase in the T4 and T3. So the system which are affected in the hyperthyroidism is cardiovascular, hypertension. Okay, you can see in then GIT, hypermotility, diarrhea, nervous signs. You see in restlessness, which is a very important sign of the hyperthyroidism. Then there is a vocalization, aggression, hyperactivity, urological increase, GFR rate, which is also important in the CBC testing. Next we have incidence or prevalence. Most common feline endocrinology affect about 3 to 8% of cat more than age of 10 years old, like it is also common in the old age cat. Then the significant mean age of onset with 30 years. You can say that it is common in the old age. Cat's general comment about the one thing you have to note in hyperthyroidism, there is an increased metabolism. If we go about historical finding, then we see weight loss with polyphagia. Weight loss with polyphagia. Okay. Then hyperactivity. You can say it is a differential clinical sign. Then irritability, restlessness, polyuria, polydipsia, and also diarrhea, because there is a malabsorption of the GIT content due to the hyperproduction of the T4, T3. Then tachypnea, muscle weakness. Okay, so next physical examination, you see cachexia, muscle loss, palpable thyroid gland, unilateral bilateral. You can actually palpate the thyroid gland in the neck region. Then tachycardia, ventroflexion. If the condition is chronic or advanced condition, you can find ventroflexion. Then cause of the in cats, there is a benign adenomatous hyperplasia of the follicular cell adenoma lead to the production of the T4 and 3, but in dogs you see carcinoma. In cat there is adenoma, while in dogs you see carcinoma. Risk factor, increase risk with aging. Okay, next we had differential diagnosis, inflammatory bowel condition. You can, whenever you see diarrhea, inflammatory bowel condition is also have diarrheal symptomatic. Then diabetes mellitus with signs of PU, PD, chronic kidney disease like GFR, increased GFR rate. Then CBC, in CBC we find ALT, ALP and AST are elevated. PCV is low as there is a dehydration with the diarrhea. So PCV is markedly mild PCV elevation. Okay, you see PCV elevation with the dehydration due to the diarrhea. Then other laboratory tests like serum total T4, it is an important T4, total thyroxine level considered is the diagnostic for the hyperthyroidism with the cat. Okay, total T4, got it. So next thing about imaging, you see thoracic and abdominal radiograph to evaluate any neoplasia or cardiac disease. Then thyroid scintigraphy can determine the location of the abnormal or the location of the adenoma on the thyroid gland. Then you see pathological finding like adenomatous hyperplasia, 90% cat, and carcinoma in dogs. You find carcinoma in dog. Then if we talk about diet, then vitamin B supplement may be helpful in curing. Then an iodine deficient therapeutic diet is available for this treatment. Client education: hyperthyroidism in dogs is usually a malignancy and carries a poor long-term prognosis. If we go surgical consideration, surgical thyroidectomy is an accepted treatment option, but it can also cause hypocalcemia after that. So if we next about drug of choice, I-131 iodine isotope with 131 is the treatment of the hypothyroidism. With methimazole is also used for this treatment. Atenolol used for the tachycardia if there is tachycardia in if present. Then carbimazole is alternative into methimazole. If there is no availability of the methimazole, then carbimazole can be used. Then we have thyroidectomy, hypocalcemia can occur. I have already mentioned it. Then prognosis is excellent in cats without the concrete disease. Treatment with the methimazole mean survival time is 2 years. Whenever you are treating with cat methimazole, there is a only chance of 2 years, or more than 5.3 years is the overall age. Cat and dog with carcinoma have a poor prognosis. So that's all about the hyperthyroidism. You can also check about the other name of the hyperthyroidism are thyrotoxicosis and plumber's disease. Okay, so hyperthyroidism, you have to keep in mind one thing, that is hyperactivity, polyphagia with weight loss. These are the three signs, you can say most prominent sign for the clinical diagnosis of the hyperthyroidism. Hope you learn much things from this topic. If you have any questions regarding this, you can ask in comment section. Okay, meet you in next recording.